Hi, I'm Ginny Finn, Executive Director at ABCD after breast cancer diagnosis.
If you have to explain ABCD to someone who's never heard of it before, what is the one message you want to get across about ABCD?
It's funny because we always think, is there a better way to say this? Every day we kind of ask that question. And really, it's what is ABCD about, which is a little different than what do you do.
Sure.
ABCD is about making life better after breast cancer diagnosis. And that's what it really is, whether that time is right after you were told, while you're in treatment, after you've graduated for treatment, or even 2 or 3 years from your diagnosis. And unfortunately, it is not at all uncommon. It doesn't happen to everybody, but it would not be fair to call it rare for a woman even with an early diagnosis to even as much as 10 years later have a recurrence, and often that recurrence is quite advanced. So no matter how you process your breast cancer experience and how healthy you are, I think I've never met someone who's been diagnosed with breast cancer who doesn't in the back of her head say, gotta be careful. Melody Wilson, our founder, used to say there is a fine line between diligence and obsession. And so you have to be diligent about your health, but also listening to your body, making sure your healthcare provider really knows what's going on with you, because they can't look out for you unless you actually tell them, yeah, I got this twitch.
Yeah,
Right.
Is it a twitch or is it a problem?
What is it?
Right.
What is it?
And then most people, it depends on the person, but I'll bring up Jackie Collins, who we just lost, who did nothing about her cancer, and she succumbed last week. Here in this situation, it's a whole community of people that you have at your disposal, and you'll pair the right person in the situation with a mentor, right?
Absolutely. And yet it's still interesting because Jackie Collins made choices that were appropriate for her. And every person will make decisions that are appropriate for her. For example, my grandmother was diagnosed with breast cancer, but she was 85 when it happened.
Right.
And so they offered her all kinds of options. And she said, you know what? Let's get it out because that will slow it down. Let's have a little radiation. Okay, I'm cool with that. But she wasn't at all interested in chemotherapy, which would have been the reasonable course of treatment. And she basically looked at the doctor and said, I'm 85.
Right.
And
Can I handle something like that?
Can I handle it? How long will it, according to the averages, extend my life? Will I be in any pain or discomfort? Will I not be able to enjoy my life if I don't have the treatment? And so she actually made a quality of life decision.
Sure.
And she had another 4 fabulous years and quite frankly didn't slow down until the end. Even though breast cancer was what took her life,
Right.
I didn't even know it until a long time afterwards. She didn't talk about it, kind of like
Sure.
Jackie Collins.
Yeah.
And I think that's another thing about pairing people one-to-one. This is an opportunity for private, confidential conversation. Many of the women and men who use our services are active in the community or participate in our gatherings or our conference calls or webinars. But many also just choose to say, you know, this is private, this is who I am, but I still am a human being and I need support and I need help.
Right.
And so that's what's great about the mentoring, whether it's on the helpline or a custom match or we're giving you resource mentoring. It's responsive to what you say is important to you.